Good evening, everyone. My name is Taylor Carroll, and I am a family nurse practitioner. I have worked in the KSB gastroenterology or GI department for about 5 years. And tonight we're going to be discussing a very important topic of IBS. Tonight we will cover what is IBS, signs and symptoms of the condition, causes of the condition, treatments we can initiate, and red flags to have investigated by a healthcare provider. So to start, what is IBS? It's an acronym that stands for Irritable Bowel Syndrome. It is an extremely common condition, and it accounts for 10 to 15% of the United States, they estimate, has irritable bowel syndrome. It is the most common GI referral that we typically see and that other practices typically see as well. How we diagnose IBS, the diagnosis is considered symptoms of abdominal pain with altered bowel habits, so constipation, diarrhea, or a mixed pattern without any other organic cause of symptoms. It is typically a chronic condition, so most people have experienced the symptoms of the condition for many years, even if they have not been formally diagnosed. If you think you are experiencing symptoms of IBS, you may present to a healthcare provider and have workup to rule out other causes behind the symptoms before we land on the diagnosis of IBS. It is more common in a younger population and tends to be more common in female patients than male patients. There are current studies happening to show a genetic component to the disease, but nothing has yet been verified. So common signs and symptoms of IBS or irritable bowel syndrome, like we discussed on the last slide, abdominal pain. This can be all different types of pain. Typically, people complain of crampy lower abdominal pain. It may be worse before a bowel movement and relieved with a bowel movement. Some people feel generalized abdominal pain. It's usually accompanied by altered bowel habits, so predominantly constipation with the pain, diarrhea with the pain, or you can have both constipation and diarrhea, which we call the mixed pattern. A symptom called tenesmus, which is the feeling you have to have a bowel movement without actually being able to produce a bowel movement. And some people may experience abnormal appearing stools where they may have mucus associated with their bowel movements. So causes of irritable bowel syndrome or IBS. There are multiple different theories. We'll kind of cover the four most common. Altered motility of the intestines. So this can be different for everybody. Everybody's colon has different contraction times, and this can affect how quickly or slowly we're moving bowel movements, which may give patients symptoms of their IBS. Also, alternations after eating. Some people may experience increased contractions after eating, which may be associated with the diarrhea component of IBS. A theory called visceral hypersensitivity. So this is a condition or underlying theory where some person's nervous system of their intestines may be overactive compared to others. So their nervous system may be sending signals to their brain that they're more uncomfortable than another person. Distension or bloating after a meal can contribute to this theory. Post-infectious IBS is a common manifestation we see. So if you have a stomach bug or get food poisoning, you may start to notice symptoms of IBS after that begin to form. A couple of reasons behind this theory. One is malabsorption, or if our intestines are different after having the infection, we may not be absorbing the nutrients from our food and drinks as we typically were, which can lead to more symptoms of pain and perhaps diarrhea. Antibiotic use is commonly associated with post-infectious as well. So any antibiotic use can disrupt the flora of the intestines and cause IBS symptoms for patients. Food intolerances is probably one of the most common theories that we work with on a daily basis. There may be certain sensitivities to food groups that patients have. Doesn't mean that they have to avoid them completely, but sometimes we try some modified diets for this theory. The most common ones we experience are carbohydrates. A lot of people experience bloating after ingesting or eating carbohydrates, which may lead to some of these other causes we just discussed. Gluten sensitivity, there is an allergy to gluten called celiac disease. If that's negative, but people can still be sensitive to gluten, that could be the underlying reason for IBS symptoms as well. And fiber, higher fiber diets tend to work against certain patients with IBS. So workup. If you come into a healthcare provider's office or our GI office, like I mentioned on the first slide, we may need to do some workup to rule out other conditions because we don't always want to assume IBS. IBS symptoms can mimic other diagnoses in GI that we would not want to miss and have correct workup and treatment for. So if you come in with symptoms of IBS, these are some common things we may do. Stool testing, we like to rule out infection causes of diarrhea. If you're diarrhea predominant, you'll probably have stool studies, and also testing of your stool for bleeding. Lab workup to rule out other conditions, like I mentioned earlier, celiac disease, and if warranted, some patients have colonoscopy to rule out other reasons behind their pain or their altered bowel habits. Treatment. So what can you do for IBS or irritable bowel syndrome? First off, we usually educate patients extensively. This can be kind of a relieving diagnosis for some patients, but also a daunting diagnosis for some patients. While IBS is not necessarily a dangerous or threatening diagnosis, it can be hard for patients to live with on a daily basis and can change a lot about their life. So educating them and reassuring them that there are ways we can help to treat them through their course of life with the condition, since it is a chronic condition. So education, reassurance, and then we start typically with diet modifications or diet changes if we notice some correlation with the IBS symptoms and what patients are eating or drinking on a daily basis. There are also certain medications that we can use for IBS patients. So there are medications that we can use to slow down diarrhea, help with constipation, help with decreasing the sensitivity of the intestines, like we talked about, decreasing the intensity of the contractions of the intestines, like we talked about as well. So red flags, like I mentioned in the beginning, abdominal pain, diarrhea, constipation, those are all very common GI symptoms, but they, like I said, can mimic a lot of diagnoses in GI. So reasons we would want you to present to a healthcare provider, in addition to what you're already feeling, would be bleeding with bowel movements. Bleeding is never considered normal. So anytime you have rectal bleeding, bright red, maroon, or black, that is abnormal and you need to see a healthcare provider right away. Weight loss associated with the symptoms. So if you have weight loss with abdominal pain, weight loss with change in bowel habits, it's never normal to have weight loss as well. So that's another reason to present to your healthcare provider. And if these are new symptoms for you, so as I mentioned earlier, IBS is typically a chronic diagnosis. If you've never had abdominal pain and change in bowel habits before, and you all of a sudden start to notice those symptoms, that is another reason you should have prompt investigation by a healthcare provider. We never like to assume that patients have IBS. It was previously known as a diagnosis of exclusion. We like to rule out all other more serious conditions that could be affecting patients before we land on an IBS diagnosis to be confirmed. So in summary, what we've covered tonight, IBS or irritable bowel syndrome is an extremely common condition. It's chronic and it can affect anyone. It is more common in younger patients and females, but anybody can have IBS. The symptoms can be debilitating or affect a daily routine and affect patients on a daily basis, even though it's not a dangerous diagnosis. There are multiple treatment options available for patients. And if you are unsure or you have new symptoms or you need more help with the symptoms you are experiencing, please reach out and see a healthcare provider. Thank you, everybody, for tuning in tonight to learn about IBS or Irritable Bowel Syndrome. And if you have any questions, don't hesitate to reach out to your primary care provider and initiate a referral to the GI office. Thank you.